Good evening to all of you, and thank you for joining us here on 13 Plus. I'm Mary Coleman. Hope your week is off to a great start so far. Well, investigations into the abuse of people with developmental disabilities are sometimes kept secret, even from the families of the people who have been hurt. Now, for those who suffer and can communicate, the unknowns are alarming. National investigative reporter Carice Jackman explores the secretive oversight of group homes, shared places meant to have the feel of home, but with round-the-clock care.
Ashley is obsessed with Taylor Swift. She loves Frozen. She loves the dogs. She loves going for walks. The fact that everything she's been through and she still loves people so much is amazing.
You still see her personality shine despite everything.
Yes, she's a real, I really look up to her in that way.
For Brittany Burr, having her little sister, 39-year-old Ashley, home is both a relief and a heartbreak. A relief to be by her side.
We can see her and we can oversee her care.
A heartbreak because Brittany and their mother Cynthia feel they had no choice but to bring Ashley home. Have you given up on the system?
Have I given up on the system? Yes, because there is no chain of command. There is no place to go to really answer your questions.
Ashley is nonverbal and has been since birth.
Can't sit, walk, talk, has a very, very limited language.
Because of her conditions, she needs 24/7 care. But to her family, finding that care has sometimes felt more like a nightmare. They say over the years there have been mysterious injuries, unexplained bruising, and medical emergencies, with little to no explanation from multiple facilities entrusted with Ashley's well-being. After several years of bouncing from facility to facility, Cynthia placed Ashley in a New Jersey group home for people with developmental and intellectual disabilities just days before the pandemic began in 2020.
Caretakers kept saying, oh, she's just tired, she's tired. And we knew that it was something much more concerning.
Then, the family says they believe Ashley was given far too much sodium, which posed a threat to her life due to her medical conditions. The group home sent Ashley to the hospital in a medical transport van, with Brittany and Cynthia following behind.
The nurses couldn't believe her overall mental status.
Our national investigative team reached out to the group home for answers. They told us that the matter was investigated by the state, and none of the allegations of neglect made by Cynthia and Brittany were substantiated. But the family says they have no idea about the specifics of the investigation.
I feel hopeless. I feel helpless. I feel like the state of New Jersey has failed my child so miserably that I don't want to stay here.
In an email exchange provided by the family, a representative of the State Division of Developmental Disabilities informed Cynthia that incident reports are confidential documents that can only be released with a judicial order. As a mother, Cynthia believes she has a right to know the outcome of her daughter's investigation.
When this involves my child, why wouldn't I be able to see it? Was there really an investigation? Did you ask more than one or two questions?
Brittany and Cynthia say they not only want accountability, they want transparency, a better system for addressing staffers with histories of complaints, and above all, they want empathy.
You feel defeated. Every little thing is a battle. And you feel very alone.
But they're not alone. In 2018, the Office of Inspector General for the U.S. Department of Health and Human Services partnered with other government agencies to investigate cases of abuse and neglect for people living in group homes nationwide. A series of audits found that people often experience serious injuries and medical conditions that resulted in emergency room visits. They also found that up to 99% of these critical incidents were not reported to the appropriate law enforcement or state agency. The Center for Medicare and Medicaid Services, or CMS, recommended a series of practices for some states to follow to help improve their critical incident reporting, including creating registries that list direct service providers who have been identified as the perpetrator in substantiated incidents of abuse, neglect, or exploitation.
We wanted to know what these registries look like, so our national investigative team contacted every state to determine which ones maintain a registry for workers accused of abuse or neglect. As of mid-January, of the 29 states that responded, 23 have abuse registries, but only 6 told us they're available to the public. For example, Ohio's registry contains names, abuse types, and criminal outcomes, while states like New Mexico and New Jersey keep their registries confidential. Others lack registries altogether, ignoring the recommendations by federal watchdogs.
Well, who are we protecting?
It should be public everywhere, and it should be uniform across the nation.
I think that's one of the most important things.
Paul Aronson is the New Jersey Ombudsman for individuals with intellectual or developmental disabilities and their families.
A lot of the reports that are done about allegations of abuse and neglect are confidential. Oftentimes the family can't even access them. To me, that's such a missed opportunity, because aside from the fact that the family deserves to know what happened and what didn't happen, they could be very useful educational tools.
Aronson has known Ashley's family for several years and has stood by dozens of families like hers. Families who also feel their cases go unheard or ignored. In his most recent report, Aronson identified 6 of the most challenging issues impacting those with developmental disabilities, with abuse and neglect at the top of the list. Aronson's report also found that a major part of the problem with abuse and neglect in group homes stems from staffing shortages.
The direct support professionals that help ensure that an individual lives a good, safe, full life in the community, but we don't pay them enough. We know that if we pay these professionals a professional living wage, we can hold them to higher standards, and we're not going to have as much abuse and neglect in the system. We just won't.
Our national investigative team combed through dozens of group home job openings nationwide to see what the general qualifications are for a direct care worker. One ad in North Carolina required candidates to have personal care dementia experience and at least 3 years experience working with people with developmental disabilities, only paying $14 to $15 an hour, part-time. Another ad for a job in New Hampshire offers up to $20 an hour. Applicants need only a high school diploma or GED. No other experience is necessary.
Setting the individuals, setting the system up for failure.
Even with Ashley now home, Brittany and her mother have struggled to find qualified workers, a challenge they say remains a constant issue.
And so in the month that she's been home, we've lost 2 caretakers.
For now, they'll continue taking care of Ashley at home, taking her on walks and keeping her in plain sight, while they continue to try to get answers from the state and fight for better care and transparency for all families.